Hi, my name is Whitney Kramer. I'm a physical therapist here at Duke. I see an assortment of patients throughout the outpatient orthopedic world. I spend part of my time in ambulatory and other parts in sports medicine. So I see a little blend of everything, all age groups and all diagnoses. Each new patient is a little different. We have the ability here through our one patient, one record, our EMR system, to read whatever background is available on them in the Duke system. So I usually begin with a little bit of an introduction, figure out what brought them into the clinic the first place, and then make sure that what I've read about them is actually what's been happening, because sometimes they'll change how much of what medication they were taking, or that in our case we do a lot of functional balance screening, and they may have had a fall since the last time they saw the doctor. So it's always good to compare, even though we do have access to those notes. And then it's just kind of letting the patient tell their story. You know, most injuries, with the exception of a surgery, didn't happen in the past couple of days. We see a lot of chronic type injuries or repetitive use injuries, and so that takes a minute to tweeze out what may be the cause and effect, as well as a timeline for those injuries, and that gives us a good platform to develop a plan of care. I have to say my true love here is my Gymnastics Outreach Program. I work with a couple of local clubs as well as athletes of all ages, developing injury prevention programs, return to sports protocols, and helping them through those injuries that are bound to happen in sports. I grew up doing gymnastics all the way through collegiate gymnastics, and so that's where my true love is, and that kind of geared me towards sports medicine through my physical therapy training. And then the opportunities at Duke allow me to work in several different departments, so I enjoy the variety.